Hello, S.A.Y and friends. We've talked with speech language pathologists. But what about physical therapists, PT? Sara, inpatient PT, and Brittanie, outpatient PT, discuss how they work with patients with aphasia, even working the body when there are no words yet. This is Sara and Brittanie. Hi!
Hi!
My hospital. First time I didn't talk, but now I have questions.
Good.
First of all, would you mind introduce yourself, who you are, and what do you do? Sara?
Okay. Hi, I'm Sara. I'm a physical therapist at MedStar National Rehab Hospital. I've been there for about 5 years. I've spent a lot of time in the brain injury unit and stroke unit, and I've also dabbled in a wide variety of other diagnoses as well. And I love what I do. And I got to hang out with Kitty.
Yeah, Kitty!
For like 6 months.
I know. It is a long time.
A long time.
What about Brittanie?
Hi, I'm Brittanie. I also work with National Rehab Hospital, but I'm an outpatient network. So I am in the Rockville area. I'm one of the neuro PTs there. So we're kind of like a branch off of the Irving Street Hospital, and I get a lot of their patients. I do a lot of traumatic brain injury, stroke, amputee, all of that, kind of just branching off of once they get discharged from the hospital, they come and see our clinic.
Mm-hmm. And why did you become the PT?
I became a PT. I graduated in 2018. Take someone from like their worst day ever, right, and progress them to like their best days so that they can continue to live a happy life.
What about you, Sara?
I became a PT because I thought I wanted to work with high-performing athletes.
Oh!
You know, like NBA players.
Oh my God!
Then I realized that the first time I stepped into a hospital, like Brittanie said, you get to help people from their worst days and try to figure out how to make their dreams come alive again. And it's truly the most rewarding career path I could possibly think of.
What is the difference between inpatient and outpatient?
Yeah. So in inpatient, so that's where I work. Our patients live in the hospital, and I go to their rooms every day, take them out into the gym, and we work and we do therapy for where I work 3 hours a day. So it's like boot camp. But you're basically living in the hospital. It's like hospital boot camp, summer camp, sleepover camp. So that's the difference. That's what inpatient is. And then I'm sure Brittanie can talk about outpatient. And then outpatient, usually I'm seeing anyone from, I could see them at most 5 times a week if it's really necessary. But usually 2 to 3 times a week is when I'm seeing people for 1 hour long sessions. And it's once they're safe to go home. So Sara makes them safe to go home and to where they can be, more independent, and then they come and see me so that way they can then function in the community and do things outside of home.
Before 3 years ago, my inpatient Sara would became my wheelchair, my walking, and then after my hospital, after my living home, and then Brittanie and I would get together to the feet and the ankle. Tell me more about my situation.
Sure, I'll start since I saw you. I think, Kitty, I saw you probably a month or 2 after your accident. And I remember incredibly vividly the first time I met you, you could not sit up by yourself. Like you were leaning Tower of Kitty. Like you know, and you needed a lot of help. And you and I got really close, both personally and physically. We like got to know each other pretty well. And I helped, and you worked so hard on learning to stand again and learning to walk again. And by the time you hung out with us for a while and you put in all that work, you left walking. I think I don't even know if you left with a wheelchair, and if you did, it was just because I was like, you know, if you just in case you get tired, you know, but you were walking all around. So you made this incredible journey with me from working on just sitting to being able to walk out the hospital doors. And that was just so impressive to watch you and your body and your mind do the work and put it in there, and got a lot out of it, girly.
Yeah, I am superhero.
Oh, yeah.
You really are.
Oh, yeah.
What about you, Brittanie? The first time I met you.
So the first time I met you, you had actually evaled with another therapist, and then you were placed onto my schedule, luckily, and I'm so happy that you did get placed onto my schedule. I think your initial evaluation, you had a cane of sorts.
Yeah.
So you really wanted to work on not using an assistive device and being able to like be active. You said you wanted to get back into the gym and run upstairs and be super wild, right? So we got you safe without the cane. And then we did things like put you on a Bosu ball where you're standing on a half ball and jumping up and down, attaching you to different bands. And then you were good for discharge. And then I think like 8 months went by and your ankle started to get tight, right? So then came to me and we got your ankle loose again because your walking had kind of started to be a little limpy again because of that tight ankle, and you learned strategies on how to keep it loose. And I haven't seen you since, but I'm so happy to see you again. You had a lot of spasticity in your right.
Yeah, right.
Right. Yeah. Right. Sorry. I'm thinking of you upside down because of the way I was doing your mobs. And I was like, what side was I on? So in your right side. So what that means is that your calf muscles, your muscles that make your foot go down, they are spastic. So if this is the bottom of your foot and I quickly go like this, I'll get a little beat, which is called a clonus. So you have spasticity in those muscles. What that means is those muscles are kind of always firing, and so they're going to start to shorten. So when you were walking, you naturally need like this ankle movement here, and you weren't getting past that 90-degree movement pattern. So when you stepped onto your leg, you kind of quickly hopped off of it, right? So in our sessions, what we were working on is stretching that calf over and over and over.
Over and over and over
and over. As well as making sure that as you walk, you're getting that heel contact, because you really liked to toe walk on that side. And then obviously just the manual mobs and things like that to improve that dorsiflexion range of motion. And then exercises to help with the decrease in the spasticity so that you can maintain that range of motion and not have to work so hard and stretch all day long.
Yeah, and Brittanie said that, what about your Botox? And I said, I didn't Botox. And Brittanie said,
no, we wanted you to.
I totally forgot about that.
So badly. And we couldn't get it done. Your poor foot just needed a little Botox.
Yeah, Botox. Yeah. I did. I successfully
eventually, yeah.
Did, yeah.
I think, did you get that after you saw me? Because we'd had discharged, right? Or, because I know your appointment with him was like scheduled way out because he was so booked. So I don't remember if I actually saw you after the Botox.
No.
Yeah, because then COVID happened.
Yeah. Now I did 2 times.
Awesome. Wow. And how's your ankle?
Your hand too, Kitty?
Yeah.
Or just your foot?
Hi.
Yeah, look at that thing. Kitty, we were stuck like this.
I know. I every day I stretch.
Good.
That's awesome.
Good.
And then the feel like my 10 hand, my 10 feet, my 10 feet, finger.
Yeah.
Yeah.
Nice.
Finger, not feet.
Got there.
My feet is here, down there.
Exactly.
My
Mhm.
finger is here.
Mhm.
You got it, girl. Mhm.
My finger is here. Ha, ha, ha.